Hello, hello everyone. This is Dr. Rahul Rane. I'm going to today speak about shoulder pain, its various problems, and how to get treated these all problems, and how to do some exercises to prevent these things. I'm Dr. Rahul Rane from Mumbai, or I'm orthopedic surgeon. I'm associated with Dr. Hiranandani Hospital at Powai, Criticare Hospital Andheri, Raksha Hospital Andheri, Sushrusha Hospital, and Godrej Hospital. And these are my various attachments. Let's go to the today's topic, the shoulder joint. As we know, the shoulder joint is look like to be a simple things, but it's a very complex structure. So you can see what is our shoulder joint. Let's see, this is the shoulder joint. If you can see over here, the shoulder joint is formed by this humerus bone. This is a scapula, the shoulder blade, and this one is a collarbone called clavicle. And shoulder is formed by four different type of joint. One joint is over here. This is a glenohumeral joint. This is one more joint, acromioclavicular joint. One more joint is over here. This is called sternoclavicular joint, and another joint is formed by this scapula bone with these ribs. So this is our shoulder joint. So let's see the various muscles around the shoulder joint. These are the various muscles. Even if you see our shoulder, it look like bulky. This shoulder forms these are the various muscle. Main muscle is the deltoid pectoralis, trapezius. These are the superficial muscle, which we have must heard. These are the various inner muscles. There are the front muscles. These are the back muscles. Subscapularis, supraspinatus, infraspinatus, teres minor, major. These are the various muscles of the shoulder joint. There are various ligaments to the shoulder joint. Look at this. These bone, to keep it at a correct posture, correct position, these various ligament help. There are various ligaments over here. These ligaments are acromioclavicular ligament, coracohumeral ligament, this scapulohumeral ligament. Various ligaments are there. All these structures, all these muscles forms a shoulder joint, a very complicated joint. And there are various nerve supply, muscle supply around this shoulder joint. And because of its complex structure, it has an entire maximum mobility among all the joint. But this maximum mobility of the shoulder joint make it unstable, which lead to various problems in the shoulder joint. So let's see to the various problems which are associated with shoulder joint. First of all, let's see what the shoulder problem presents as. Shoulder problem mainly present as pain in the shoulder joint. Then the restricted movement. Movement does not happen proper way. This is the major problem in the shoulder joint. Sometimes the shoulder joint feels like it is coming out of its own way, giving way. This is also happening in the shoulder joint. Then these are the various problems. These are the various clinical features of the shoulder joint. Let's go in deep and see what are the various reasons behind all these problems, the pain, instability, giving way. So let's see what are the various problems. So there are injuries happening due to accidents, sports injuries, frozen shoulder, it's a very common problem, leads to shoulder dysfunction. Then joint dislocation, joint dysfunction, rotator cuff injury, muscle injury, ligament injury, some impingement. As I mentioned, shoulder joint is a very mobile joint, but this leads to various muscle, ligament, structural impingement in between these two bones. There are age-related issues, the geriatric problem, and radiating pain happening in the shoulder because of this is happening somewhere else and pain felt in the shoulder joint, the radiating pain problem. Let's see the frozen shoulder, the first and very common problem of the shoulder joint. You must have heard this frozen shoulder from various people, your physician, your physiotherapist. So what is this exactly, the frozen shoulder? This frozen shoulder is constriction of the joint capsule of the shoulder joint. This constriction, restricted movement of the shoulder joint leads to further pain, and this things keep on happening. So various different type of painful movements start happening in our shoulder joint. This is associated with a shoulder joint problem. Now, why this happen? As I mentioned, the capsule get constricted, and this leads to further restriction of the movement. There is inflammation happen. If you can see this slide, look at this. This is our normal joint capsule. This the inflamed joint capsule. When this inflamed joint capsule try to do some movement, this lead to further aggravation of the movement. And these are happening at various places, mainly happening in the shoulder joint. It can happen at other joints of the shoulder also, and this lead to the frozen shoulder. People afraid of moving the shoulder joint because there is pain. They don't move this shoulder joint, this capsule further contract, the inflammation further increase. They don't move, and this circle keep on increasing. People don't move, patient don't move, the shoulder capsule again contract, people don't move, it again contract, and slowly it become very difficult to people, even when the patient even not able to move this joint. This is a severe type of shoulder, frozen shoulder. Let's go to the treatment option. What is the treatment for this frozen shoulder, the common type of the problem? Treatment is first and foremost is to treat the underlying cause. Mainly the diabetic are very prone for the frozen shoulder, but there are various type of arthritis, the rheumatoid arthritis, other arthritis. This lead to the shoulder joint pathology. Sometimes there is an inside injury which is also lead to the frozen shoulder. So we have to treat this underlying cause. We have to give definitely the medication for all these problems. Physiotherapy is very important in the shoulder joint, in the frozen shoulder. Physiotherapy plays a very big role. Even injection inside the shoulder joint are very helpful to treat them early. And after doing all these things, if it is not being completely cured, then the arthroscopy, a minimally excessive procedures can be done in the shoulder joint. Now let's go to the shoulder joint injuries. What are the various type of shoulder injuries? What are the various reasons? How to treat them? Let's see. These are sports injuries are very common in the shoulder joints, since it's a very flexible, so much of range of movement. So any throwing movement, badminton, cricket, swimming, basketball, volleyball, all these movements lead to the various problems, various muscle tear, ligament tear, bony injuries, even accident, blunt injuries. These are all various reasons for the shoulder joint injury. Sports injuries in shoulder is very common. Almost after the knee joint injury, as equally as knee joint injuries, the shoulder joint injuries are very common in the sports person. So the main treatment, what are the treatments in this? If you are at the ground or something has happened, not accessible to the doctors, what you have to do? You have to give rest to the patient, apply a sling, you can apply ice, you can give them some painkiller if it is available. The treatment wise protocol is the same. We generally give patient these type of braces which help to reduce the movement of the shoulder. They keep the shoulder joint in the immobilized position, apply ice, give them medications, and after that the pain subside, then the physiotherapy to strengthen the muscles, ligaments, and gain the movement of the shoulder joint. If it is not being treated by all these means, then definitely the surgery is the required. But most of the things doesn't require surgery. Hardly very few conditions and very few severe problems require the surgeries. This is all about the shoulder injuries. Now let's see about the shoulder dislocation. What is the shoulder dislocation? If you can see over here, this is the normal shoulder joint. This is the normal shoulder joint. It is staying, this ball is staying inside this cavity. This is a ball and socket joint. This is a cavity, and this ball is inside over here. This forms a ball and socket joint. This ball and socket joint is moving in all direction and giving us an entire movement, like this movement, various type of movement. But because of this entire movement, high mobility, this becomes unstable, and there is a chance that this come out of it, and this is called the shoulder dislocation. This can be partial, this can be complete, and this is again anterior, posterior, superior, inferior, depending upon the type of thing. The main treatment for this, of course, your doctor will reduce this thing and bring back this ball, the head, inside the cavity. This is the main treatment for the shoulder dislocation. But we have to, if you can consider, you can understand, look at these are the various ligaments over here. Can you see these are the various ligaments over here? If these ligaments are intact, definitely this shoulder won't move. Look at this. These are fixed with this ligament. It is not at all moving. But if I cut this ligament, if this ligament get torn, broken because of something, then definitely this shoulder will get dislocated. So in the dislocation, these ligaments are definitely broken. So we have to deal with this broken ligament. If there is persistent shoulder dislocation, repeated shoulder dislocation, recurrent shoulder dislocation, this ligament need to be repaired. If there is not very severe injury, then they heal by itself own. But if if they are torn to a great extent, then definitely surgeries are required. There are various type of now surgeries. Minimal access surgeries are very common right now in the shoulder joint. Even I do that very commonly. These shoulder arthroscopic procedures can be done very easily, very cosmetics, give the entire range of movement, very common in sports persons, and patient can return to its normal sport activity. This is about the shoulder dislocation. Another problem is the shoulder impingement. Shoulder impingement is like, again, the shoulder joint itself is a very mobile joint. It keeps on moving. And there are two bones. So this bone and this cavity, there are various structures inside this cavity, in between this bone and cavity. This structure get compressed in between these two bones and cavity, the head and this cavity. There are other structure in between. You can see this get compressed, and this is called the impingement. This impingement. So this impingement, it's a mechanical problem. If this impingement is happening, particularly repeated, if I'm doing this movement, even after the impingement, even the structure getting compressed in between. So you yourself can consider, slowly, this structure will get injury, it will have microscopic injury. Slowly the injury will increase, this ligament will start breaking, and this particularly the ligaments, the rotator cuff will have a huge tear. This need to be repaired as early as possible, because it will have to severe pain, difficulty in movement. Sometimes it's persistent, then the shoulder dislocation chances are there. So these impingement things causing rotator cuff injury or any further ligament injury, muscle injury need to be tackled by surgery. Let's see what I was saying about different types of a surgery. Definitely the surgery doesn't require so commonly. Just to tell more about the options of various type of surgery, I just want to show the different type of surgery. You can see this is the open surgery. If you can see over here, this is open surgery. This produces this type of scar. These are old type of surgery, even right now are also done. When we have to put a plate or any implant inside, we need to do this type of surgery. And there are newer type of surgery in which no scar is formed. Can you see? A very small, you need to see it very carefully. The scar are not seen. These are done by this arthroscope, a small tiny instruments. So these are the newer things are available right now, done very frequently, very safely. Patient, even hospitalization is also not required. 2 days admission and stay in the hospital are required. So these are the various things. But as even I want to tell you, these are not very frequently required. Hardly 5% of the patient require the shoulder surgeries. We can prevent various type of injuries by strengthening our muscle ligament. So today we have Dr. Archana, Master of Physiotherapist with us. She can tell more about how to prevent various type of injuries in the shoulder joint and strengthen the muscle. So please, Dr. Archana.
Thank you. Thank you, Dr. Rahul, and good evening, everyone. So, as Dr. Rahul explained very well, that shoulder is a very mobile joint; it moves in all directions. So, there are many chances to get it hurt very easily. So, how we can take care of that? Because there are so many structures around the shoulder joint, so we have to take care of many structures. There are many problems can happen. So, how physiotherapy help to get rid of these problems? So, I'm going to tell you in very short how physiotherapy can help you, and how you can strengthen your muscles at home. So, role of physiotherapy is to improve the range of motion of your joint, because as we all know, in a frozen shoulder or any type of shoulder injuries, the main problem happen is the pain, and then another is the stiffness, means reduce the range of motion of the joint. So we give emphasis on that to improve the range of motion of the joint, means strengthening of the muscles around the shoulders and around the scapula, around the arm, then improve the mobility of your joint, and after that reduce the pain and stiffness of your joint. Now we are going to see what are the exercises. Like we all know, frozen shoulder is one of the common problem for your shoulder joint. So we are going to see some simple exercises. There are various exercises are pendulum stretch, towel stretch, finger walk, cross body stretch, armpit stretch, outward rotation, inward rotation. I'm going to show you the pictures of these exercises. So these are some simple pictures of for these exercises. Uh, the first one is a pendulum stretch. This is the pendulum stretch. In this exercise, we have to hold any water bottle in your hand, or any wet cup in your hand, and then do the pendulum movement by taking the support of a chair or table. Give all the weight on that normal side, and just do the pendulum movement of your affected side, like forward and backward, like a swing. You have to move your hand, and inward and outward rotation also, and then circular direction also, like clockwise and anti-clockwise, right? Then this is the arm circles. In this we have to do it with both the hands, like clockwise and anti-clockwise. We can do the arm circles. Then third one is a shoulder flexion exercise. This is the shoulder flexion exercise. We can do it with the help of pulleys. Here the pulleys are applied. We can apply at home, or if you don't have this arrangement, we can do just like raising your arm and try to touch your arm to your this ear. We can do this exercise at home for the shoulder flexion, or we can hold our affected arm by your normal palm, and we can take it upwards for the shoulder flexion. Then this is a cross body arm stretch. We can take a palm of your affected side towards the shoulder of your normal side, and we can stretch it. This is also called as a capsular stretch for adductor capsulitis or frozen shoulder. It is helpful. Then towel stretch. As we rub the our back after your bath, we can do this towel stretch. We can take a towel in your hand and do the movement at your back for your rotations. So these are some exercises for frozen shoulder, and these exercises we can do in another cases also, like any adhesive capsulitis or any tendon injuries or whatever rotator cuff injuries, where there we cannot do the range of motion. We can do all these exercises to improve the range of motion. So now I'm going to tell you something about sports injury and physiotherapy. As Dr. Rahul has already explained, and the shoulder is a very mobile and this a highly unstable joint. So, and there are many structures around the shoulders like tendons, bursas. There are many chances of getting it dislocated, or there are many type of sports injuries can happen, like sprains, strains, tendonitis, bursitis, synovitis, fractures, dislocation, and rotator cuff injuries or any muscle injuries. Because many sports like the throwing action, like in bowlers or in badminton players or volleyball players or all these players or any dancers or swimmers, we use the shoulder for any movement, and any of this movement can cause to any injury to any of this structure, and we may get hurt it, and we may get a pain. So what is the role of physiotherapy for these injuries? We recommend ice pack if we are having any swelling, and for reduction of the pain also we recommend ice pack. Then we give manual therapy. In manual therapy we give joint and soft tissue mobilizations also. It also help in reducing the muscle spasm and increase the joint mobility and reduce the stiffness. Then we give the trigger point release, as we many of us many time suffer from the trigger point or the band formation in our scapula. We feel like any gathan जैसा लगता है. So we give a trigger point release with help of the particular movement. Then we give a glides. In frozen shoulder, there is a range of motion is restricted mainly, so we give different type of glides to improve the range. Then we give various type of stretching and strengthening exercises. Then the education and activity modification, like if a particular muscle is involved, or in particular activity patient is having pain, or athlete is having pain while doing any particular movement like its overhead activities, so we educate them or give them education and for the muscle strengthening for group of the muscles. And then postural correction, many of the athletes complain, like badminton players or cricketers or volleyball players ki while throwing movement or while doing the overhead activity we feel a pain in our shoulder. So we give them guidance for their postural correction also. So in a particular posture they can do the same movement, but they will not feel the pain. So these are some guidance for the role of in the sports injuries. Then shoulder stretching exercises. I'm going to show you some shoulder stretching exercises. Actually, all these exercises we all can do at home for maintaining the joint the strength. But before going for any sports playing or for any athletes, we can do it as a warm up exercises also. So this is a cross neck stretch. This is a shoulder stretch. As I told you, we have to stretch your shoulder on opposite side. This is a tricep stretch by taking the elbow behind your back, and you have to stretch the tricep. This is also a tricep stretch only in another direction. And then this is the shoulder up stretch. You have to shrug your shoulders and you will get a shoulder stretch. Then shoulder and back stretch by interlocking the fingers, and you can give a nice stretch to your shoulder and back. Then behind the back lock stretch, you are interlocking the fingers and giving the back stretch to your shoulder. And this is a lock side pull stretch. In the same direction we can give a side pull stretch also. So these are some simple stretching exercises, but while doing this exercise be careful. If it is hurting you, please don't do it, or do in front of your doctor once and learn it properly and then do at home. Then these are some shoulder strengthening exercises with the help of band. We can use a band or stick at home, or we can use a TheraBand also at home to do all these exercises. This is a band flexion exercise. While holding the band in the hand, we can take it up slowly and we will do the flexion of your shoulder. Then this is a band extension exercise. While holding the band in the hand, we can take the hands backwards away from your body for the extension. Then this is a band exercise for internal rotations. Like holding on this direction, we can do the internal rotation. And for band external rotation, we can lie down like this and pull the band up away from the body for the external rotation. Then this is the shoulder abduction and adduction. Abduction means away from the body and adduction means towards the body. So while holding the band, we can do like this, abduction, and towards the body adduction. Then band exercise, horizontal abduction and adduction. While holding the band up front, we can do in both direction, abduction and adduction. Then this is a wall walk, or we can call it as a finger ladder also. With the help of fingers, we can climb like a wall on the wall and go as much as possible while facing towards your wall. We can do it for shoulder flexion, and facing away from the wall we can do for the shoulder abduction. This is the wall walk exercise. This is the pectoralis stretch exercise. While standing at the door and at the corner of the door, and we can do a nice stretch like this. Sway here, you hold your hand on the door and sway forward to get the pectoral stretch. This scalene muscle stretch we can do by like these movements of the neck to give the scalene muscles of your upper back and neck muscles. Then this is the thoracic extension stretch. We can hold both of your fingers interlock and hold at the back of your head, and we can do this thoracic extension stretch like this. Then scapular squeeze. We can squeeze both of your scapulas and hold it and feel the squeeze or stretch at the upper trapezius or scapular region. So these are some shoulder strengthening exercises. These all exercises we can do for maintaining the strength of your shoulder, or any shoulder problem patients also can do the exercises, but with the guidance of your doctor. Now I am going to show you some physiotherapy for senior citizens. These are the very simple exercises for our senior citizens that at the home they can do it. Like take both your arms and towards your neck, towards your ears, and hold it. Try to hold it there. Then your cross arm stretch. Then again this is a stretch for your tricep muscles. Then give a nice stretch to your shoulder and upper back region. Then we can do a sideways stretch also like this. So these are simple exercises. We all can do it at home. So this is all about the physiotherapy and exercises for your shoulder joint problems. Actually, there are many types of exercises, and according to case, it vary. If say for a single muscle or group of muscle, vary from patients to patients also. But these are simple common exercises that we can do at home. Then I'm going to show you some ergonomic advice for the shoulder injuries. Please avoid sleeping on your affected side. Always sleep on your normal side, because on affected side it may come pressure and pain may get aggravated. Then use a pillow to support your shoulder joint and arm. Always use a pillow. Then avoid using heavy weight lifting by your affected shoulder, because it may aggravate the pain. Then take ice pack or hot fomentation according to your case. If there is a stiffness, you can take a hot fomentation, and for swelling or spasm you can take a cold fomentation, or alternately also you can take ice and cold fomentation. And do the regular exercises. This is very important. Do regular exercises for both shoulders to maintain the strength of your joint and improve the mobility of your joint. So I hope you get all the answers. Then take care at home. Thank you.
Thank you so much, Dr. Archana, for giving a lovely session on the preventive measures. Let's hope everyone will be benefited because of with this session. Any questions are there or are welcome. You can definitely post here all your questions. You can share this video with your friends, family, and this is very definitively will be helpful to each and everyone. Thank you so much.